Ballarat.
Thank you very much, Madam Speaker. And it is with some reluctance that I actually bring this matter of public importance on. Reluctance because I am someone who's worked almost their entire life in the public health and preventative portfolios. It is probably one of the most important areas in health to try and prevent diseases, to actually work with public health organisations on what works in prevention and to try and manage those conditions. But never before have I actually seen a circumstance where almost every public health organisation in the country is coming to me to express their concern about the Assistant Minister for Health, who has responsibility in this government for prevention. Never before have I seen public health officials, public health officers across the country from a breadth of organisations show this level of concern about a minister this early for a start, but certainly a minister who has got responsibility for, Madam Speaker, who has responsibility for one of the most important areas for health. We all know that one of the greatest challenges we're facing in health today are those that are preventable, and clearly the member opposite does not understand this nor care about health prevention, nor what his Assistant Minister has done. We all know that the greatest challenges are in the area of prevention. We know that some of the greatest gains that we can have in the health space are in prevention, particularly to reduce obesity, to reduce diabetes, to reduce risk factors of cardiovascular disease and stroke, a very important area. So let's have a look at what's actually happened recently in this space. When we were in government, we engaged Neil Blewett to undertake a comprehensive look at food labelling, and in particular to look at what you could do in the space of food labelling to look at health promotion and prevention. One of the recommendations that Neil Blewett came up with was that there should be a traffic light labelling system on the front of all packaged foods. Now, in government, Labor didn't agree with this. We took the decision that we would not accept that recommendation. But what we did understand that there was a clear demand from the Australian public for better information about the foods that they consume, particularly as we were starting to see a substantial increase in processed foods and packaged foods that are in our supermarkets. We knew that consumers did not understand the daily intake guide, the thumbnail sketch that you see on the front of all of the packages currently. So what we did is that we agreed that there was a need to establish an interpretive front-of-pack labelling system, but that it would not be traffic light labelling or the daily intake guide. When the government proposed this, many public health groups were hardly willing to participate in the process. They were unhappy with our decision not to back traffic light labelling. They did not want to sit down with the food industry at all, but we managed to get them to the table. They said at the time that there was no possibility of getting any agreement with industry and no possibility of developing an interpretive system that would provide consumers with accurate information and truthful and clear information that had not already been explored. Instead, what we saw was 2 years of cooperation, 2 years of detailed work, led quite deliberately by the Secretary of the Department of Health, Jane Holton, to bring industry together, to bring public health officials together to come up with such an interpretive system. That interpretive system, the star rating system, a very good system, and I encourage people, if you can actually find any information out about it, I'm happy to share it with you. This was a very important piece of work. The system continued to be developed, and it was agreed. It was agreed by all states and territories in June last year. The substantive system was agreed in June. The system continued to be finalised after June. Communications material developed, the website developed, and a steering group formed. A steering group continued that work to develop that website. It wasn't just Labor on a frolic. It was, in fact, most of the state governments who endorsed the system were not Labor governments. An important system. So then what we've seen subsequent to this is in December there is a meeting of the food regulatory ministers. At that meeting there was no substantive decision required about the Health Star rating system, no substantive decision required. There were some technical details. The calculator had to be agreed. But what we know from that meeting's communique is that Senator Nash, the Assistant Minister for Health, attempted attempted to try and get that food star rating system stopped. And we see from the communique that what she did was instruct her department to develop a cost-benefit analysis, not something that had any bearing on the system's further development, because it was a system agreed by all state and territory ministers. So what is the reason that Senator Nash has not supported this system? And why? Why on earth would she instruct her Chief of Staff, someone who we now know, and we now know she was aware, that was the owner of a company that lobbied for the junk food industry, to take down a website providing information about this voluntary agreed system? Why would she do such a thing? Information about this has only come into the public domain because it was first reported by Amy Corduroy, the health editor in the Sydney Morning Herald. And we've seen reports today that at least one of the companies that would receive a less favourable rating under the new system than its competitor products is one of the very companies Senator Nash's former Chief of Staff represented. Senator Nash is the minister who is supposed to represent the preventative health sector. In the words of the Sydney Morning Herald political editor Peter Hartcher, Senator Nash is the Assistant Minister for Health, but behaved like the Minister for Big Sugar and Alcohol. That is a damning indictment on a minister, and certainly a damning indictment on a minister responsible for health promotion and prevention. The minister's big achievements to date in her portfolio have been to rip down a website promoting an agreed voluntary food labelling system and to shut down the Alcohol and Other Drugs Council. ADCA had been providing advice to government since Menzies was Prime Minister, but this government doesn't agree with what they had to say, so what do? They get rid of them. And why did Senator Nash insist that this website be taken down? Well, we've heard three excuses. The first, that it was a draft and it's not ready, and I can tell you that is absolutely and simply not true and has not been repeated by the Department of Health. The only person who unfortunately has repeated that was the Prime Minister yesterday, and he was incorrect. Second, the system wasn't in place so that it would be confusing. That was the next excuse. And of course, the reason that the system was not in place is that the website was actually required to be placed up so that industry could have access to the technical material so that they could actually start using the system and consumers could be provided with information about the system. The third excuse that has been used for why this website was removed was that because there was apparently unanimous agreement at the December meeting to do a cost-benefit analysis. Now, a simple look at the communique will tell you that that is wrong. We have now got the South Australian ministers and the Tasmanian health ministers again confirming that this is absolutely incorrect. Senator Nash's decision to instruct her department to undertake a cost-benefit analysis is a matter entirely for her. That information may help to inform evaluation of the system. It had absolutely no bearing on the establishment of the system already agreed in June. The minister has continued to allow that statement to be on record in the Senate, and she has continued to refuse to back down from that mislead. The whole point, as I said, of this website was, in fact, to actually provide information to consumers and information to industry to actually develop the system. Now, we know from further information that has continued to come out, it is well documented that the minister's former Chief of Staff was a director of a company that lobbied for the junk food industry. And indeed, he appears to have retained his directorship in this company right up until his resignation a fortnight ago. A resignation, I'll add, in which he said he claimed had been done with a clear conscience. Contrary to the Prime Minister saying he had done something wrong, the Chief of Staff resigned with a completely clear conscience. It says a lot about the minister's priorities when it comes to preventative health, that she should decide to employ a junk food lobbyist as her Chief of Staff in the first place, let alone allow that Chief of Staff to influence a decision as important as the front-of-pack labelling Healthy Star rating system. And I begin where I started. This is the minister in this government responsible for health promotion and prevention. I have never seen a circumstance where public health organisations from across the country, en masse, are calling on the government to reinstate the health food star rating system and have no confidence in this government's minister.
Time has expired.